Hi, I am Dr. Bree, and today I want to answer a question that I just got, and it was such a great question. So here's the question. I'm going to read it. It says, is it possible for my symptoms to get worse during the first days of practicing the stretches? Is it possible for symptoms to get worse before they get better when starting a pelvic floor rehab program? And basically, all of my programs start with stretches and release work. So this question is really, really valid. And the answer is yes, it is possible and it's quite common for things to actually feel a little bit worse before they get better as the body is reorganizing and essentially as the body is having to catch up with itself. Because lots of changes happen as you initially begin your healing journey. There's lots of changes. Your body has gotten used to one way of being. And as things change, it's like just this surprise attack on your body of things feeling different. And I'll tell you how this can present in different cases of pelvic floor issues. So I want to talk to you about pelvic pain. And I also want to talk to you about bladder leakage and prolapse. And if you stay to the end, I'll give you an exercise that can really help to calm your nervous system. And it's great for your pelvic floor as well. So even if you're feeling like symptoms are getting worse during the first few days of your treatment, this little technique that I'll show you at the end can really, really help. So let me first talk about pelvic pain, which is often really wrapped up with a lot of tension and tightness in the pelvic muscles. And when people have a lot of pelvic pain, sometimes your symptoms can feel worse before they get better. They can feel worse during the first few days of stretches and movement exercises and breathing exercises and somatic exercises where you're really coming into your body. Our mind and body is designed to constantly be protecting us. That is its only job. The nervous system, its job is to scan for threats constantly and do what it needs to do to protect us. Let's say you have endometriosis and there's pain involved in endometriosis. And so your body tries to protect you from the pain by bracing up, by clenching and guarding with the muscles. And over time, that pain tension cycle creates more pain and more tension and more bracing and guarding. And it creates this protective shell and armor of tension. It also creates a nervous system that's on high alert. And any change, even if it's a positive change where your muscles are starting to have a little more blood flow, have a little more relaxation, it's still a change. And for your nervous system, it's like, uh-oh, there's something going on here that's different. And that's kind of scary because it's different. And so that's one reason we can have pain is because it's a change. Our tissues are starting to change. And when there's a change, our nervous system can go on high alert, especially when it's already on high alert because you're somebody who's dealt with long-term pain. That can create more signals that are essentially danger signals to your brain, even though it's not actually dangerous. It's a good thing that your body is starting to relax. But we can get our signals crossed sometimes. And sometimes that positive change can be interpreted as, uh-oh, this is different. The other thing is if there has been armoring and muscle tension and guarding, then as blood flow and sensation starts to return to these very numbed out muscles in many cases, because sometimes we have so much pain that our body just kind of stops feeling altogether. And so as sensation starts to return, as blood flow starts to return, it can create sensations that can be perceived as pain. And so just know that that is possible. Of course, there's also the possibility that maybe you're experiencing some muscle soreness because you're maybe stretching a little too far or overdoing things in a certain way. So that's something to look out for as well. But sometimes even when you're doing everything just to the perfect level, you're still going to experience some symptoms as you begin to heal pelvic pain. Now let's talk about bladder leakage and pelvic organ prolapse. So in those situations, I will always, in all of my programs, teach you how to relax and release the muscles first. So that can feel really weird for people who are used to clenching and tightening their muscles all day long to prevent bladder leaks or to prevent that feeling of bulging and downward pressure that prolapse can create. So many people with bladder leakage and pelvic organ prolapse will tighten and clench their muscles all day long because they unconsciously, subconsciously are thinking that that's going to help prevent the symptoms. But actually, it makes things worse. And so, our first step is to release those tight clenched muscles because the tight clenched muscles are not working effectively. They're just kind of halfway contracted constantly. So they're not able to effectively do their job of supporting you, of closing things off when you need to. They're so tired. Basically, they're exhausted. And so learning how to release those muscles can feel really weird to someone who has bladder leakage or prolapse. It can feel like, oh my gosh, I can't do this. I feel like everything is falling out. I feel like I'm leaking, or maybe they are actually leaking more temporarily. But it's a really important step to learn how to release and let go of those muscles before you strengthen. Length before strength. You've got to have muscles that are at their proper level of resting length before you exercise and strengthen them. So again, it can feel weird and it can feel like your body doesn't quite know how to handle itself because it's used to being a certain level of tension and now you're letting that go. So your body has to adjust to this new level of release, to this new level of relaxation. And it takes a minute for your body to catch up and realize, everything's actually okay. We're just finally relaxed again. So now our muscles can actually work better. So that's one reason. Another reason is that literally as we do the work that I teach in my programs, which is about releasing the muscles and then gradually strengthening, we work a lot on posture and breathing in my lift program that really help you reposition your body and your pelvic organs to be in a better position. Now, when this happens, what is going on is your pelvic organs can literally reposition themselves into the place they're supposed to be, at least a better place than their prolapsed position or the position where there's strain on your bladder because of pressure, because of the way you're sitting or standing or holding yourself, and there's constant leaking. So when things reposition, let's say, for example, when the bladder just changes position a little bit, lifts just a little bit, that's a good thing. But what can happen is it can actually straighten out the urethra, which is the tube that your pee comes out of. And when that happens, if it's straightened out, that can make it so that you're leaking a little bit more. So your body just has to readjust to the new, better positioning of your pelvic organs. And it's going to take some time. It doesn't happen overnight. But there's a lot for your body to get used to. New levels of resting tension or relaxation, I should say. New ability to contract and release the muscles at the right time. New posture and positioning that allows the pelvic organs to be in a better position so that things aren't getting pressed on and kinked. But it does create some reorganization that your body has to get used to. And your body will catch up. It's just at the beginning, there can be some weird days where things feel worse. And so just know it's temporary. Your body will figure it out as things reorganize and your body will catch up. Now, if you're having severe pain or if you are like, no, things just keep getting worse, then there's a few things going on. Potentially, you're doing the exercises incorrectly. Maybe there's something about the instructions that you just don't understand, or you're not doing an exercise the way it's intended to be, and you're actually, for example, pressing down or bearing down instead of lifting, or instead of releasing and relaxing, you're actually squeezing. There's many reasons why you could be doing an exercise accidentally, just doing it a little bit incorrectly. And if that's the case, then you need to talk to somebody like a pelvic floor physical therapist or somebody one-on-one who can really give you some help and support and do an examination and make sure that you're doing your exercises correctly, that you're standing and sitting with your posture correctly, that you're breathing correctly. These things all really matter. And if you're accidentally doing them wrong, then it can cause problems that last. So ultimately, this things getting worse before they get better should be transient. It should be temporary, maybe a couple weeks, not like a couple months. If it's a couple months of things getting worse, then that's definitely a problem and something that needs to be looked at. I don't want anyone to hurt themselves. Now, if you are having these issues and you're feeling stressed about the fact that, oh my gosh, things are getting worse before they get better, then I want to show you a simple trick and tool that can be really, really helpful. So, this is a breathing exercise that comes in three parts, and it's based on various things I've picked up over the years, and I want you to try it with me. So, what you're going to do is begin with a breath that has you inhale the flowers and cool the soup. So, what I mean by that is you're going to breathe in through your nose and out through your mouth, slowly and gently. We're just getting started with our breathing, coming into the moment. So, breathing in through the nose like you're inhaling a flower, the scent of a rose, and then exhaling through your mouth like you're cooling the soup. So it's not a strong, really strong blow, and it's not super light. It's just a gentle cooling the soup exhale. One more time like that. Inhale the flowers, cool the soup. So that just gets you used to breathing in through your nose and out through your mouth, which you don't always have to do, but for this exercise, we're going to do that. In through the nose, out through the mouth. Okay, so the next step is now we're going to inhale through our nose and then exhale out our mouth with a ha sound, H-A. So let's do it together. Inhale through the nose and exhale through the mouth with a ha. Great. What this does is it stimulates the breathing diaphragm to help really activate the vagus nerve to really increase the parasympathetic relaxation response in our body. We want to signal to our brain through the vagus nerve that everything's okay, that we can slowly breathe. The diaphragm, it helps activate the vagus nerve to say, everything's okay. Everything's okay. And it also uses our vocal cords. This vibration of our vocal cords is also a great vagal toning technique to help induce the relaxation response. So the next sound is inhale through the nose and exhale with a hoo sound, H-O-O. So, hoo, and try to make it low in your belly, a real low kind of guttural, visceral hoo. You can do it again if you'd like to. But if you want to move on with me for the next sound, it's going to be inhale through the nose and exhale with a voo, V-O-O. And this is something that's talked a lot about by Dr. Peter Levine, who is a master in the world of somatic healing. And he is somebody who uses this technique a lot. So you're going to inhale through your nose and exhale, voo, voo. So just say voo, long and slow, and feel the vibration in your pelvic floor, your low belly, in your viscera. Feel it almost like it's coming from your pelvic bowl. Of course, you're going to feel a vibration in your throat as well, but bring it up from the depths. It's activating your deep core and pelvic floor muscles. It's also activating that relaxation response. So give it one more try. Voo, and you can make it long and drawn out. I hope you're doing it right now. I hope you're practicing. It almost sounds like a foghorn. Voo. And you can do it a few times, just focusing on that voo. I like to breathe in through my nose and then voo, and just feel how this softens the breathing diaphragm, the pelvic floor. It mobilizes the energy in the deep core, deep belly, pelvic floor, breathing diaphragm, heart, and vocal area. This whole core area is mobilized and relaxed and calmed by this simple sound. So we did ha, we did hu, and we did voo with our exhales. And that's something you can do anytime. Just take it slow, go at your own breathing pace. You can do this for as long as you want. It really does make a difference in calming you down, making you feel safer, and making you feel more relaxed and at ease if you're having a freak out moment because you're feeling like your symptoms are worse before you get better. You need to ride out this tough patch. Again, if the tough patch lasts for a really long time, then that's a problem. That's different from what I'm saying. But in most cases, it's just temporary and you will get better. Okay? So, yes, it is possible for your symptoms to get worse before they get better. You're going to be okay. And keep going. Keep the faith. And if you want to learn more about my programs and online offerings that I have, and also my in-person retreats and events, check the video description and I will have some links and resources for you. Until next time, remember, eat clean, move every day, and you will shine brighter. Bye.